Welcome back to JR Sunday. We're here at the Detroit Golf Club overlooking the 18th green. Hopefully to get a champion later this afternoon, weather barring. One of the most important roles out here, especially in a week like this, is the health and well-being of fans on the course, players, caddies who are walking the course. We had a Pro-Am out here on Wednesday. Joining us now is Dr. Jonathan Carrier. You have a big responsibility this week.
Yes, it's been a busy week, to say the least. The weather's thrown us some curveballs, but it's been fun, and it's Sunday.
Henry Ford Health provides all of our medical and health services out here, as well as with the Detroit Lions, the Detroit Pistons, where at the Performance Center you do much of your work. This week, as you kind of go through the week, Wednesday, we had team members that were out here from the Detroit Golf Club, from Rocket, from the Intersport team, as well as many tree companies.
All right.
A few of us got banged around pretty good, especially some of us that are a little older, throwing the gloves and the boots on and moving limbs. Then you go into the Canadian smoke, especially with the Pro-Am, and we were watching that very closely and watching the levels. And now the storms with lightning, a lot to deal with, not only for the players, caddies, but also the fans.
Yeah, it's been busy starting Sunday with that tornado that rolled through, causing a lot of damage. Fortunately, no significant injuries. We did have a laceration that we sutured up. And then rolling into the Thursday, Friday, the AQI levels, or the air quality index levels, were quite high in the 200s. Different associations have different cutoffs. The PGA had a cutoff. We got close to it to have to potentially cancel play. Fortunately, didn't reach there, but it did put us on high alert. We were concerned that patients with underlying pulmonary condition, asthma, COPD, may have an exacerbation on the course. Fortunately, we did not see that, but a lot of heat-related illnesses and ailments through the course of the week, which the humidity is leading to. And unfortunately, some of our spectators don't hydrate quite as well as we'd like them to.
They hydrate, just not with the right things sometimes.
Exactly, right. And then on the player end, that's my individual role. I did assist in developing teams for coverage on the emergency as well as sports medicine side. But I will be treating players and caddies throughout the course of the week. Come Sunday, things lighten up a little bit. But while they're going through their practice rounds, and definitely on Wednesday at the Pro-Am, they're coming in. We evaluate and treat for medical ailments or injuries that occur, and determining whether or not a player can return to play.
Many of the players would travel with some of their own team, and I'm assuming some of that has to do with health. That
is exactly right. We do have players that have their own personal trainers, physical therapists that travel with them, depending on what level of play. But they don't travel typically with their own physicians. But there are, you will see the occasional doc, personal provider. So we get a mix in terms of talent that comes to see us.
So let's segment it into two different areas, and let's take the area that you're focused on, that's players and caddies and the personnel that's walking. The team that you lead out here, talk me through like the different categories that you might be providing service to those.
Right. So it can be as simple as a cut or scrape coming in needing a Band-Aid, or a contusion from someone hit by a stray ball. On the player end, typically the physician's evaluating them in our medical trailer, providing a care, if it's an illness that we need to prescribe antibiotics for, or actually an acute injury that requires treatment, we can triage that, potentially get them ASAP over to our clinic to get imaging if we feel it's indicated, and potentially an intervention as long as we clear that through the PGA. Our athletic training staff is robust. We have them positioned both at the trailer to provide treatment, but also on the front and back nine more for our spectators, staff, and volunteers. So we have them positioned accordingly, so if they need to make an emergency action plan to get somebody transported off the course, we can do so in a timely fashion, get them to the hospital if we need to expedite care.
In football, both college and pros, you'll have an individual up in the booth that's looking down and maybe will trigger a concussion protocol process. Out here, do you ever get calls of there's a caddy that doesn't look like he's doing well, or there's a player who looks like he hurt something, or is it something that you just wait for the call to come in?
Yes, we actually do. We have a dispatch, which is centrally located. So when volunteers call in, or staff, if they see a player that looks like they're having some difficulties, or a caddy or personnel, they will call out. We'll send a medical provider there to lay eyes on them and determine if it's something we need to evaluate. Usually we're going to go and initiate a conversation. We did actually have that happen on Wednesday. Unfortunately, nothing major, but we did wrap up that player's day a little earlier than anticipated.
And you bring up a whole other category, and that's volunteers, more than 2,000 of them out here.
Right.
That's a small army that's really keeping their eyes on what's happening. I'm assuming that you have some intervention there where you may have to provide some assistance or care to.
Correct. Actually, a lot of our heat-related illnesses that we've seen, heat exhaustion, heat stroke throughout the course of the week, has been our volunteers, and they're busy. You know, they want to keep eyes on the course, keep things running smoothly, and not always paying attention to their own health, unfortunately.
As you watch this event, I know you're focused on what you do. I've watched very little golf because you're busy keeping things operating, but is there a player out there that you hope to win, and is there a player out there that you think will win?
Well, that's a great question. So Ricky, I feel like he's turned things around. I would love to see him win this tournament. I'm always rooting for the underdogs, though, too. In terms of a player who I enjoy watching, Max Homa, so we'll see.
He started off good today.
Yeah, so we'll see how he turns around.
Any other interesting stories that have come along that you can share? I know you can't share everything that you deal with, but anything interesting?
Right. That's a good question. We have had some unique evaluations, particularly Wednesday. We've got a group of caddies that might have been partaking a little bit too much.
Hydrating, we call it.
That we weren't expecting to have to treat for heat-related illness is what we called it, but we knew what was going on. We had to cut their day a little short and give them some fluids, so we have had that. The stray balls, I'm always surprised every year. We're all paying attention, but particularly that Pro AM, on how many people actually get struck by a ball. Fortunately, it's usually limbs and no life or loss, but on occasion it's a more major injury. And this is my first few years really covering golf at this level, not something that I thought would happen as often as it does.
I played with an individual in the Old Buick Open that used to be up at Warwick, and he hit 7 individuals before he was asked to leave the course.
That would be me.
So, first of all, I appreciate you being here and helping support the Rocket Mortgage Classic. The work that the Henry Ford Health does out here and is spectacular. Stepping away just for a moment, your work, 365, what are you involved in? What are you engaged in?
So I'm in the clinic, nose to the grindstone, 5 days a week. I work as a team physician for Lawrence Tech University, as well as a local high school in Plymouth. So my week, I'm evaluating patients, performing interventions, ultrasound injections as a non-surgical provider, one of the procedures I perform. Also EMG, nerve conduction, so evaluating peripheral nerve injuries, and performing X-ray guided injections of the axial spine, so lumbar epidurals, for example. So I like to, I knew going through medical school that treating patients was my passion, so I knew I was going to be in the clinic.
Sure.
And we'll see where this, that road takes me. I just started practicing in 2019, so I'm opening my arms to any opportunities that come my way. So
I know Henry Ford has such a good relationship with so many, with the Pistons, the Lions. Michigan State has a very close connectivity.
Right.
I believe you have I don't know what you call it, but a medical student from Michigan State, and that's great that you're creating those kind of opportunities.
Right. That's a very unique rotation that the NFL is actually lead on, and this is their second year in a row. So every NFL team, to my knowledge, is offering this rotation. The goal is to increase and diversify the medical student interest in sports medicine. So we're taking underrepresented individuals, rotating them through with the Lions, and as well as our Henry Ford sports medicine physicians. I won't name drop them, but yes, she'll be rotating with us. We're very excited to have Dr. Oge with us.
No, that's wonderful,
Yeah.
and we appreciate the connectivity. One of my best friends in college is Al Bellamy, who was a head trainer with the Lions. He was at Syracuse. He was at Temple. And he just recently came back with the head trainer for the Washington NFL team. So he's my connectivity to that part of the world. So.
Right. It's a very unique world,
Yep.
but it's fun.
Dr. Jonathan Carrier with Henry Ford Health, thanks for joining us today, and we'll let you get back to the work of the day as they're on the course, and we'll see what happens.
Thank you so much for having me.
Thanks
Appreciate
so much.
you.
We'll be back right after this on JR Sunday.